Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center here in Southern California. We are a group of 8 healthcare providers, physicians. We have MDs, DOs, naturopathic doctors, physician assistants, all who are interested in doing a functional medicine, integrative medicine, natural medicine, and we have between all of us, maybe over 100 years of experience. And we meet monthly for a few hours. We discuss our cases that are challenging, get each other's feedback on it, bring up patient case studies, and look at the scientific literature and discuss articles. So we really do look at our patient base and our own experience, as well as the experience of our colleagues, and then the general body of information growing in integrative functional medicine. Of course, we practice the standard of care and we use our consultants. We do this YouTube video every week at 6 o'clock on Tuesday nights for an hour, where we invite you to type in your internet email questions to us at tlcdoctors.com, tlcdoctors.com. And if you're on our email list and you want to type in a question or get notification, we will send you that. And then there's a link on that and you can type in your email. I have a few pages here. And then we have the internet YouTube chat where you can type in a question for the live audience. I will defer as much as I can to what we see live typed up here. And this is not meant to be individual medical advice, but these are generalized responses. If you have concerns, you should consult your doctor, and or if you are one of our patients, schedule an appointment so that we can deal with your unique issues. So let's begin tonight, October 31st, 2023. And on the live chat, we first have Sarah. Sarah says, "Hi, Dr. Rita. I'm pregnant." Oh, congratulations, Sarah. Is that your second or your third child? And you're trying to do a carnivore diet, but you're battling nausea and strong meat aversions, mostly eggs and beef. Do you have any helpful tips or information that can help? Well, you might start, I don't know what your blood type is, but if you're a blood type A, you would use digestive enzymes when you do eat meat or eggs or any high protein item. We generally recommend that for blood type A. And nausea is usually mitigated, or it's reduced when you have a richer protein diet. And so if you're having nausea or difficulty digesting it, maybe you could find a good protein drink. Orthomolecular has OptiCleanse GI. That is a very good broad spectrum multivitamin protein drink. So you might try that as well. But we're made of protein and fat, and so the baby needs plenty of protein and fat. So you have to work through that and try some digestive enzymes maybe. That's what we would recommend to our pregnant patients and go from there. Hopefully that works out well for you. You can, of course, ask your OBGYN if they have any tricks up their sleeve. But when I was a young doctor, we used to hard boil eggs and give it to all the women in our lower income area. They couldn't afford much of a protein in their diet. And we really reduced the nausea of pregnancy with eggs. So soft scrambled or poached eggs were the best there for helping them. So you need protein and fat, and that will help suppress the nausea. That's what we have experienced in our pregnancy, nausea associated with pregnancy. Let's see. The next question also is Sarah. And she says, I was born with an Omphalocele and abdominal surgeries at birth. I'm missing my gallbladder, and when I had my babies, couldn't produce fatty, nourishing breast milk. What could be the cause? Well, you have to eat enough protein and fat to make the milk. And so it's all about if your blood type is A, you should use your digestive enzymes with your richer protein diet. Fish is usually very easily digested. Chicken with the skin on it, poached eggs, things like that. But use your digestive enzyme and drink plenty of water. Christina says, hi, Dr. Rita. I had labs done last weekend. Today I was told my cholesterol is 230. I'm 39. I weigh 144 pounds. I eat mostly garden veggies, meat, eggs, butter. I'm confused on this. Everything else is fine. Well, here's news. Your 230 is fine also. A cholesterol of 230 is nothing to be worried about. I would direct you to go on YouTube and look up a YouTube that's titled High Cholesterol is Healthy. The title is High Cholesterol is Healthy. And it was put out about 6 months ago by Dr. Ken Berry, Berry, and Dr. David Diamond, Diamond, PhD. So one's a family practice doctor and the other is a PhD. And in it, they review the literature on cholesterol, the most recent scientific surveys, retrospective meta-analyses, and the data is conclusive. You have been bamboozled if you are worried about cholesterol. We're made of cholesterol. These membranes in every cell in our body, these pictures of cell membranes have cholesterol all throughout the membrane in various parts. You need plenty of cholesterol. So go watch that YouTube, and that should help you. And you can follow up with your doctor and share that video with them too. Sarah says, I'm B positive. Okay, well then I would still maybe use one digestive enzyme, Sarah, to help you with your digestion. Otherwise, see your doctor, follow up with your OBGYN or see your doctor. Tiziana says, hello from Seoul, Korea. Wow. Hi, Tiziana. Long way to be, and you must be involved in some activity there with your Pilates and instructor and all that. Christina then goes on and says, thank you. God bless. So I hope it goes well for you there, Tiziana, with all your training and your workouts and your Pilates and all those things you're teaching, physical therapy that you've done. So proud of you. Congratulations. Thank you. All right. Let's see. Our first question from the email is Terme said, nicotinamide adenosine dinucleotide, NAD. I've heard that it has cognitive benefits as well as building muscle and helps against aging skin. If it's all true, which brand do you recommend and what dosage? Thank you. I don't use individualized NAD, never have and probably never will. I just use a methylated B complex, which assists in the whole pathway that is involved in hundreds and hundreds of reactions enzymatically that build and repair all cells throughout your body. To pick one item out is to take a Boeing 747, and it probably has 2 million individual bolts, parts, and cogs and whatnot. And to say that one is critically more important, I'm sure there are some that are very critical and others that are less so. But as far as the actual flying mechanism, they're all important. So you see, we go through these fads, NAD, resveratrol, anthocyanidins. These coenzyme Q10, ubiquinone is another name for it. All these nutrients that they learn in energy production inside the mitochondria, you would think that, we discovered the source of life, and actually it's the balance. Water, without enough water for all this to happen, and none of these things are useful. So drinking enough water, getting exercise, getting a good sleep cycle, not clogging it up with a high processed carb diet. These are the wonderful things. So niacinamide, niacin, which is usually in a very good B complex, and taking a good multivitamin once a day is probably adequate for the average patient, and not be sucked into all these fads. But yes, technically NAD is valuable in all these things that are mentioned here, but are there good human studies that it's going to really enhance vision or muscle building or cognitive function? They do rat studies, they do various, biochemical studies on this, and they just don't exist. Therefore, I wouldn't get caught up in this. I would spend more of my time thinking about, did I get in weight training, weightlifting? Did I get in enough aerobic exercise? Did I drink, half my weight as pounds as ounces every day of water? Did I eliminate some sugar, starch, processed food? Did I take the time to sit down and plan a good, healthy menu as organic as I can? That's where you should put your time and effort. There is no vitamin that pulls all of us. The closest thing that I would say is the best vitamin would be, and the most research that we have the greatest amount of human studies on, is the Juice Plus series, the fruit, vegetable, and then the berry vineyard. That is the most researched nutraceutical in the world, and associated with DNA damage diminishment and immune function enhancement, and children's studies with weight loss. It just goes on and on. So if you want one thing to probably take, that would have the most science and human studies behind it, as far as a name brand that I would recommend. The second item would be vitamin D3. I would get it with vitamin D3 with K2. And let's see, so that's two items. What would be the third? Multi-mineral that's chelated to amino acids like magnesium glycinate or magnesium citrate. These with potassium citrate, minerals that have amino acid chelates. Why? Because minerals are the templates. It's like God's cooking pots and pans for making new tissue and repair. What else? Pretty much we got the Juice Plus, we got D, we got the vitamin D2 Juice Plus minerals. That's pretty much the base that I would say is critical. All right, let's go to the next question. It came up on the live as Dennis says, can someone be obese yet metabolically healthy with normal blood pressure, cholesterol, and blood sugar? The answer is yes, and that is the mesomorph. There are studies that there are just some people who genetically are always going to carry an extra 30 pounds with them, and that would put them in an obese category, somewhere with a BMI under 39 or 35 to 39. These people have excellent blood sugar, triglyceride, insulin, hemoglobin A1C, fasting blood sugars. And I'm probably one of those mesomorphs because my blood sugar typically is in the 50s or 60s, and my triglycerides are typically 30 to 40, those kind of ranges, with a hemoglobin A1C in the 5.0 range. Now, so the answer, Dennis, is yes. And some of the studies have said that the mesomorph, these kind of people, live the longest overall. So more studies need to be done. There is a doctor by the name of, what is his name? Lustig, Dr. Lustig, Lustig. And he is a pediatric endocrinologist, and he's famous for the book or the video called Sugar, the Bitter Truth. Sugar, the Bitter Truth. And in it, he brought out about 15 years ago the fructose and the glucose excess in processed food and the damage to our children, and the fatty liver that's developing. Now more studies are into the uric acid aspect of this. And he became extremely upset with the food systems, the school food eating, all the food recommendations of the American Diet Association, and all the high percentage of contributors to the American Dietetic Association's recommendations. All these lettered individuals, or the vast majority, are linked with the processed food companies. So it's like they're bought off to just rubber stamp saying that Reese's peanut butter cups are better than a hamburger. So it's kind of sad, but he is the one who points out, you could put the name Dr. Lustig, Lustig, and metabolically obese, healthy. I think if you put those terms together and Google it, you'll see some of the scientific papers and where he gets up the longevity data on that. Sarah says, I'm predisposed to getting preeclampsia as I have had severe preeclampsia with my first baby. My doctor told me to take baby aspirin to prevent preeclampsia. They said it's safe, but I need to know for sure, is it actually safe while pregnant? This must be the same Sarah as the beginning up here. Sarah, if you are pregnant and you are under the care of a OBGYN, you should follow their instructions. It is commonly done. My understanding is, although I don't practice deliveries anymore, that was many years ago for me. We didn't use aspirin then. We wouldn't even give a pregnant person any immunization shot, let alone aspirin. But nowadays, there is study work that shows that the low-dose baby aspirin, 81 milligrams once or twice a day, is associated with blocking certain prostaglandin cyclooxygenase enzyme activity that will promote, microclotting. Thromboxane, I think, is the pathway there. Anyway, so it's associated with tiny microclotting, and it prevents that. So follow your OBGYN, and yes, I am aware now that they are recommending it. If I had a daughter of my own or a granddaughter and she asked me, I would probably personally advise my family to use systemic enzymes like Vitalzyme or Vascuzyme. Drink half your weight as pounds as ounces. So if you're 150 pounds, you would drink 75 ounces of water every single day. Take a walk, avoid the processed foods, sugars, and use the enzymes along with a good multi-vitamin mineral, the vitamin D. And we recommend Juice Plus and the iodoral, one a day for iodine salt. That's what our recommendations are. But follow your OBGYN. And yes, so Sarah had these two questions already put up there. So I answered those already. So Patricia said, I have some supplements from a company called Premier Research Labs. One is vitamin D3 and K2 that lists the vitamin D3 as Vitashine 5000 I use, and K2 as Menaquinone. Is this fine? I have never heard the term, Patricia, of Vitashine. I'm going to have to write that down and look into it. Vitashine. Never heard that. I think that's a trade name for a source of vitamin D. Vitashine. Yeah, that has to be a trade name for the D3. This is Premier Research Labs. Okay. Menaquinone is a decent vitamin K2, so that's fine. So I think it's probably good, but I don't know this product. You'd have to wait till next week. I'll try and look this up. But there is no such thing as Vitashine in biochemistry. That's got to be a trade name for their cholecalciferol, which is the vitamin D3. Danielle says, do you know of the best Christian counselor? Is there a way to reduce or eliminate several policy? I don't quite understand that sentence there, but what is the best lotion and body wash to use for severe dry and itchy skin? So I guess there's three questions here. Do you know of the best Christian counselor? We have a counselor here called Andrea Owens, and she's not here on Wednesdays. And so that would be who I would recommend if you are in the area here. Outside of that, I don't know anyone, but hopefully you're in the area here. Second question, is there a way to reduce or eliminate several policy? I don't understand that question, Danielle, so I can't answer that. What is the best lotion and body wash to use for severe dry and itchy skin? Well, I would not shower every day. Most Americans shower too often and they dry out their skin. I think taking a shower as cool as you can with as little soap as you can once a week, and then do sponge bathing in your armpits and groin and your feet separately. Your skin makes the oils. You could use parent essential oil. You should be eating enough of the natural sources of fat and protein to help make healthy skin that preserves your natural oils and such. Looks like we have some live questions. Lee C says, put castor oil with heat on liver, broke out itchy, bumpy, and raised thin on cheeks. I put Argentin 23 spray 3 times a day. Take quercetin, 1,500 milligrams C, 1,500 milligrams zinc D, 10,000 turmeric, a low carb diet, bone broth all day, tea tree oil, shea butter, exercise. What are your suggestions? What happens to my body? It is toxic unloading, allergic reaction. So you apparently put castor oil with heat on your liver, and then you broke out with this, I get it now, itchy, bumpy, red raised skin. And you probably were detoxing, Lee. Outside of that, I don't have an answer. I don't know the products you're using. I don't know what fillers they use. But if you have a rash and itching like that, maybe you should see your doctor or urgent care if it's, I don't know how long it's been going on. But it sounds like a Hertzmeyer reaction where you're accelerating detoxification too quickly. That's possibly the situation. But your age makes a difference. Any medical issues that you might be having, your amount of water you drink, what's in your diet, what is your blood type, what are your bowel movement patterns like, all these things come into play. So it isn't just about us taking as many supplements. It's about trying to eat a simple a diet with natural organic, drink your water, exercise, get a good night's sleep, not eating late, and see your doctor to look through these things as opposed to trying taking all kinds of supplementations. All right, let's go back here. Elizabeth says, hello, I have an 11-year-old son who eats a whole foods standard American diet. Whole foods standard American diet. I never heard it put that way. He has recently developed asthma and allergies since we relocated to the state of Georgia. What can I do about healing this naturally? Um, People with blood type A, our children, are at higher risk. I've seen, that's my clinical experience. And I think it's because A's don't digest as well. Therefore, they don't make intrinsic factor. Therefore, they don't make B12. B12 is very important in exercise and asthma and so many other factors as well. I would find out your son's blood type, find a good doctor there locally, and ask him to find out your son's blood type. I would give him a good methylated B complex. And if your son weighs 80 pounds at 11 years old, you can treat him like an adult dose. That's my rule of thumb. If they're about 80, 85 pounds, I treat them like the adult dosing. And then I would, with finding out his blood type, when you say whole foods, I would tell your son that he has to stay away from chips and bags and packaged foods, that he should be eating fruits, your vegetables, your fish, turkey, beef, chicken, but, bread and toast and pancakes and waffles and those kind of things, burritos, all this packaged stuff, I wouldn't do. And there is a website you could go to, ACAM, ACAM.org. That's the American College for the Advancement of Medicine. It's probably the oldest organization, and they have a physician locator. And you might type in your zip code, and that you'll find, if you define the radius within 50 miles or whatever, integrative doctors, functional doctors, and they can look at that. But finding the blood type, if he is A, you can give him a digestive enzyme with betaine hydrochloric acid. That helps with digestion. And a good multi-mineral that has magnesium in it and zinc, of course, potassium and calcium. So a good multi-mineral, the digestive enzyme, the methylated B complex, and vitamin D, K2, at least, 2,500 to 5,000 a day. And then have his blood levels checked, and that should really go a long way to help him. Linda says, my friend has rheumatoid lung disease with arthritic lesions in his lungs. Rheumatoid lung disease. So rheumatoid arthritis is an autoimmune joint disease. And I don't know if you're meaning arthritic lung lesions in his lungs. When the chest x-ray is there, you can see the spine, and there's some spinal and rib connections that could be so, because there's really no lung tissue rheumatoid lesions that I'm aware of. Can you explain that disease and maybe some helpful hints for them? Thank you. Well, Linda, I would have your friend stop all processed food, especially grains and dairy, just 100%. If that person could go 100% on a carnivore diet, that's the #1 elimination diet. If you went on just all fish, turkey, chicken, beef, eggs, bacon, meat, that kind of stuff, and get all plant food, because there are anti-nutrients in plants. And he's probably having some, or that friend of yours is probably having some difficulty with processing the plant kingdom foods. And try that for about 3 months. Find out his blood type. And then if the blood type is A, definitely get him on orthodigestive enzymes. Find a doctor who has this. I think this is only available by physicians, orthodigestzyme. But it has the betaine hydrochloric acid in it, and the digestive enzymes and the bile for the fat absorption. Now, the other thing is to, if the person is a different blood type, but they're older, let's say they're 50 years or older, then they probably need the digestive enzyme because they're getting older and not digesting as well. Then I would give them enzymes like Vascuzyme. These are systemic enzymes that you take on an empty stomach to help with inflammation in the joints and the inflammation of the body. Now remember, if you get all the plant foods out and you become a carnivore to heal with for 3 months, you'll know within weeks, say a month, that you're feeling better. And you might even see the difference in 3-4 days if you're a pure carnivore, because you're getting all these other biochemical signals out of your body. Then you can talk with your healthcare provider about slowly adding back a rotation of other things if you really want to be a omnivore and kind of get some plant things back in. Do some allergy testing for foods and sensitivities, and complete digestive stool analysis. I presume you've got a doctor, or he has a doctor, and they've done the rheumatoid factors, and they've done other autoimmune studies. But enzymes, blood type, carnivore, and digestive enzymes would be the start. That's how I would begin. Constance says, is ham and bacon okay to eat? Yes, they are. I think they are considered processed meats high in sodium. Well, we would encourage you to get the uncured kind that doesn't have nitrates and stuff in it. But bacon and ham are fine. You can have the, I buy it from the butcher box, and they are free range pigs. And so they are not getting, any feedlot grains like that. They're free and out in the wild there. They're getting, throwaways from the farmers' tables and things like that. But yeah, it's fine to have ham and bacon. And I would not use excessive salt, but some salt is used in curing, but it's not nitrated. So that's what I feel about that. All right, Cynthia says, let's see, Sarah asks, what would you recommend for me to do to prevent preeclampsia, or at least lower the risk? Well, do all the healthy things that I'm saying, in the sense of drink half your weight in ounces of water every day. Take a walk, 15 minutes twice a day. Never eat late past 6 o'clock, 6:30. Get all the processed food out of your life. Use the modest salt to taste. Be careful not to use too much salt. Get all that sugar, starch out of your diet, and use a good multi-mineral with magnesium in it to help relax your blood vessels, amino acid chelate, and take systemic enzymes to be an anti-inflammatory. And that's the direction I would head. Christina asks, what is your favorite meat, veggie, and fruit? I never eat fruit, ever, never. No sodas, no fruit, no berries, nothing. I use Juice Plus. But my favorite meat, I would have to say, is a chuck roast, slowly cooked. That's my favorite meat. And then favorite veggie. I don't eat a lot of veggies either. But I would have to say, what is my favorite veggie? I would have to say broccoli, probably buttered with salt and pepper. And so that's where I live. So Rana says, when is it time for testosterone? DHEA may not be working any longer. Yeah, so you can add in testosterone cream topically, even though you're taking DHEA. And if your testosterone level, is 200 or 300, I think that's still reasonable even for a woman, because men should be like, 800 to 1600. So, and that will help with muscle tension and mass and strength and endurance and health and so forth. So yeah, if your testosterone isn't at least 70, then you might want to, and you're taking DHEA, then you might want to add in some topical there, okay, Rana? And then the next question is, What would you recommend to do a week before surgery to prepare the body as much as possible for a quick recovery? What would help after surgery? Thank you so much for your time. Cynthia, fasting is the most human growth hormone repair, autophagy promoting, self-cleaning, growth hormone, and other somatostatin promoting things to do. So if they say fast 12 hours, I would fast 24 hours beforehand. I would, I tell my patients to stop the systemic enzymes like Vitalzyme, Vascuzyme, uh, Proteozyme, all those systemic enzymes 4 or 5 days before surgery because they're anti-inflammatory, and so they help prevent blood clotting to a tiny, mild degree. And you don't want to have a little ooze. The surgeon doesn't want to have little tiny capillary oozing. So stop your enzymes about 4 days at least before surgery, but the day after surgery, double them up. So if you're taking, like I take 5 once a day every day, I would stop it 4 days ahead of time. But the day after surgery, I would take 5 twice a day for 2 weeks. Now, after surgery, they're going to just mindlessly say, eat, eat, eat. But I would fast, if you could, another 24 to 36 hours after surgery. You'll get better cleaning of the wound and bruising, less scarring, a better scar formation will form. If you can get in EDTA chelation with vitamin C the day before surgery, that would be beneficial. Studies with EDTA on animals have shown it helps preserve the microcirculation so that if you're under and the perfusion, you're laying there for an hour or 2 or 3 or 4, the perfusion is sluggish. So people who get EDTA chelation before surgery tend to do much, much better. As soon as you can after surgery, I would do an EDTA chelation with vitamin C. And I would eat a very rich carnivore diet all the way up to the 24 hours before surgery, because it's going to take all that protein and healthy fat to repair all these membranes here and all the cutting that they have to do. So that's what I would say. Make sure you're taking your vitamin D and taking your multi-mineral and taking your B complex, those kind of things. I would stay on that. Dawn says, should a 50-year-old female cycling every 28 days on estradiol and progesterone bioidentical creams be concerned with monthly migraine symptoms? Shouldn't hormone replacement therapy buffer hormone fluctuations that influence migraines? Yeah, you're right, it should. So typically, we believe systemic inflammation, probably from your diet, is something that is triggering. You might find some craving during a menstrual cycle, and you tend to eat. This might be aggravating, but you would have to see your doctor about that. Assuming low carb, proper exercise, water, sleep, stress, supplementation, blood pressure is usually 120/80. So migraines aren't blood pressure related. I would take enzymes. I would use systemic enzymes like Vitalzyme or Vascuzyme, and I would use 4 or 5 twice a day on an empty stomach, especially coming up to the menstrual time. And remember, ovulation is a egg ovulating out of a corpus luteum, and that's inflammation, and it calls for a inflammatory response in the body, and that is often associated with triggering migraines as well. So see your doctor, make sure it isn't a food, make sure you're hydrated enough, make sure you take the enzymes as you start to ramp up towards your menstrual cycle, and see if that will stop it. Because the hormones, if they're well balanced, should not be doing it. And then, of course, see your doctor. Robin says, Dr. Rita, I'm 65 years young and have never had a colonoscopy, but my liberal family doctor is constantly recommending vaccines and a colonoscopy. I am obtaining a stool sample test to see if there's anything to be concerned about. What are your thoughts? Well, I'm biased, Robin. When I was around 39 or 38 and practicing on active duty, my brother-in-law, David, was only 45. My sister was 6 years older than me, and her husband the same age. And he and my husband were working on construction. My husband's a wonderful carpenter, master carpenter. So was my father-in-law. And they were doing this big job, and everything was great. And we had steak dinner. And then a week later, my sister called me and said, my husband's ankles are swollen. And I thought, that's odd for a man, 45. He should be healthy. And I said, it should go away. Have him put his feet up, and then it should go away in the morning. And about a week later, she called me back and said, the swelling is now up to his knees. I was shocked, and I said, please come to the hospital, because I was working in the hospital then. And we got a CAT scan on him, on his abdomen, and he had colon cancer, metastasized everywhere. And he died 3 weeks later. Now, so what I'm telling you this is I'm biased. He was only 45, and back then the recommendation was just starting to make sure everyone did it at age 50. And there was no real family history either. So colon cancer is a silent cancer, and our diet is so inflaming and corruptible. It's a challenge. Therefore, I am for getting a colonoscopy done. I would get one in my life for sure. And then they do the Cologuard. It's not a replacement, but depending on what they find, I would get your first, and hopefully that would be, very normal, and go from there. But please don't push this away. And we see colon cancers are on the rise. So please take it seriously and don't put it off. All right. Let's see. The next one is Art. Are tingles in the hands and extremities common associated with migraines or low magnesium if blood pressure is normal and the coronary artery calcium score is 0 in a non-diabetic? Art, there are many things that can cause paresthesias, tingling in the extremities and hands and feet. Could be the minerals. Magnesium is the number one mineral that's deficient. Could be potassium. Could be the nerve plexus coming out of our neck and our pelvic into our legs. Could be, if you said your blood sugars are good, I would see your doctor and get a good metabolic screen and look for inflammation. And I would take a amino acid chelated good multi-mineral and get that checked with your doctor, with your magnesium, potassium, calcium, and make sure they're in optimal ranges. So I think normal is like 1.6 to 2.2. I would like my all magnesiums to be 2 or higher. I would do stretching. I would do Pilates, something like that, and make sure the microcirculation and water consumption is good. And then you have to get tested for heavy metal. You might be bioaccumulating aluminum, lead, mercury, cadmium, arsenic. So see a good functional doctor, Art, and start working up and looking down those pathways. Pamela says, can you give the name of the holistic dentist in Irvine you mentioned before? Thanks. I think he is in Newport Beach, and his name is Dr. Son, S-O-N. He's right by the airport there, and that's the one I use, Pamela. Katharina, I'm lactose intolerant with blood A type. Are dairy milk substitutes like oat, almond, soy milk okay to consume? I don't notice any guy issues, but not sure. I think you meant any gut issues, not guy. I hope you don't have guy issues. I don't notice any gut issues. but not sure if the manner which they are processed makes it better to avoid. Thank you. Katrina, we're not meant to consume nut milk and things like that. That's not typical. That's we're getting a high exposure to all the lectins that would be in these almonds and stuff, oxalates and other anti-nutrients. That could suck up your zinc levels and minerals. It could disrupt these things. I am not in favor of these drinks. I am in favor of the way God set it up, water and herbal teas or coffee, black coffee. And that's just the way it is. And trying to find these things are marketable, it's entertaining to the mouth, and it's killing us. Trying to, feed this monster of making every time we open our mouth an entertainment. The thought is, what would I like? Rather than I will eat, to maintain health. They've worked very hard on brainwashing us and making us addicted to high fructose corn syrup and such. So we have to fight back. So I'm not in favor of oat, almond, or soy milk products. Now, a little bit occasionally. What's occasional? Once a week, but this concept of making our smoothies and using them all the time, no, I'm not in favor of it. I've just seen too many years, too many decades of people having trouble with it. Cynthia says, my 17-year-old daughter has been having sudden weakness in her arms and hands, both sides. It will happen about twice a day and will last about an hour each time, and says it feels dead. Her blood work included an anti-nuclear antibody test, which came back normal. She had a spine and brain MRI, and it didn't show anything that could explain it. Do you have any guidance? So many things to ask. What is her weight? What is her blood type? What is her fasting insulin? What is her blood sugar? If this is twice a day, I'm going to bet that this might be married up with something she's eating, and there's a gut reaction, inflammation, microcirculation, constriction, and hypoxia, and poor circulation. That's the direction I would go. If I were seeing her, I would probably do a heavy metal challenge and see what her aluminum, her mercury from all the vaccination injections they've had, that kind of stuff. And then I would want to know if she received any of the mRNA injections. But please find a good functional doctor. Find out what her heavy metal load is. Please get food allergies, a complete digestive stool analysis. Get systemic enzymes. Put her on a carnivore diet for 2 months and see if this all goes away. All right, Lily says, this is the same thing I think that was over here. Lily said she put castor oil with heat on her liver and broke out with an itch. Yeah, we already answered that one. And then the next page is, hi again. I sent the question regarding, DHEA, NoPep, etc. Curious on your thoughts on aqualaurin, a water-soluble version of monolaurin as well. Same patient has high toxin trouble detoxing. Did series of 30 chelations, no help, in great health physically and blood work wise, besides the toxins and ALZ, which we feel are related. Carly, Alzheimer's? I guess that's what, so let me read this again. Hi again. I sent the question regarding the DHEA NoEP. Those are things, those were, trade names for, when we discussed this last week. DHEA is a peptide, which I thought they were, to enhance cognitive function, but there's no human studies on this stuff. Same with the PRL-8-53 and NooPept, NooPept. These are supplements based on polypeptide, which act like neuropeptides messengers. Well, I would say exercise, eat a high protein fish, chicken, turkey, beef with digestive enzymes, do chelation therapy, get a good night's sleep, drink your water, get on natural hormones if that's possible, either the testosterone for male or estradiol, progesterone for female, get on systemic enzymes, low carb diet. And that's how I treat all my Alzheimer patients, and they always get better. So why take things that are marketed, have really no human studies, only mouse studies, and those only were helped with injured mice. So it's really a traumatic as opposed to a developmental lifestyle, cognitive Alzheimer, dementia, dysfunction. So it's to be seen. So dihexa, Nupept, all these things are not established, and they're sold over the counter because they aren't prescription drugs, they're peptides. And in rat studies, there seems to be some value, at least mild, but nothing jaw-dropping. So I'm not convinced on that. I would continue chelation. I would continue systemic enzymes. I would exercise, push the water, and I would be very low carb, and I would eat a very rich protein, healthy fat, organic source for protein and fats with digestive enzymes. Get on the hormones, find a good naturopath or functional medical doctor of osteopathy, and go from there. And that brings us to the end today. So unless there are other questions, again, if this is of value to you, please like and subscribe. Please leave a comment on the end of this video. Go to the video and type in a question. I am trying to look there and answer the questions there. It makes a difference. We are exploring other methods of access to what we would call our frequent flyers, to have a more private group. But we want to continue to grow this, so please share it. Please like and subscribe. And with that, since I've done all the email questions and I have finished a long, hard day of work since 5 o'clock this morning, I am tired on my work day. And I will look up this Vitashine. I'm sure that's a trade name product there. And I hope that satisfied you about the dihexene and so forth. So, Carly, I hope that helps you. So God bless, and keep us and treat each other like the wonderful creation we all are. Everyone is made in the image of God. And so we should treat each other with that respect no matter what. Good night. God bless.